Many exciting new things as it relates to treatment of patients with MPNs. One, I'd say updated information on drugs that are already available for individuals. Ruxolitinib, great updates on continued safety and efficacy with very long-term follow-up now with both PV and in myelofibrosis. Second, many ruxolitinib combinations, some of which with drugs that are already readily available. So ruxolitinib combinations with thalidomide, with azacitidine, with decitabine, with pegylated interferon. All positive, all some nuances between their efficacy, but again, moving us closer toward combinations of drugs that physicians have really readily at their disposal. Second, I would say combinations with new agents, ruxolitinib with PI3 kinase inhibitors, or other novel pathway inhibitors. There's important updates on our other JAK inhibitors. There are updates that I'll be providing as it relates to pacritinib as a JAK inhibitor, helps with spleen, helps with symptoms, even in people with a low platelet count. And I presented a pooled analysis that helped to both further demonstrate that, as well as showing consistent benefit in those patients with thrombocytopenia and those who do not. Further updates in the activity of momelotinib, helping anemia in patients with myelofibrosis with a potential mechanistic observation as it relates to hepcidin and inflammation. A lot of buzz regarding the new trial opening up with fedratinib, trying to bring that drug to patients as well. Finally, I would highlight updated information on standalone drugs, both imetelstat, PRM-151, and other drugs that are showing clear activity in second line in myelofibrosis, and very excited to see those data proceed. It's a rapidly evolving piece, but I think increasingly the ability to both individualize prognosis as well as potentially develop new therapies for patients, I think will become increasingly obvious. Another such example, it's becoming increasingly obvious that ASXO1 tends to develop and accumulate while patients with MF are on therapy. What is the relevance of that? Should we target that? Should that adapt or adjust therapy in some way? These are open questions, but just an example of more and more detail in the biology that we are learning.